February is Heart Health Month, and many here in the Commonwealth struggle with many of the issues that commonly comprise heart health.
Problems that you can have there. And Dr. Naveen Rajagopalan is a cardiologist at UK who specializes in the treatment of heart failure and is in now with more on what you can do to stay heart healthy and even some medical options that are available to help people suffering with issues. Thank you so much for coming.
Thank you. Pleasure to be here.
Basic question, it sounds so ominous. What is heart failure?
So heart failure is a condition where the heart is literally unable to pump enough blood to the body, and this can result in fluid backing up into the lungs. Patients with heart failure often suffer from shortness of breath when they do things, so they can't do the activities that they want to do, playing with their kids or just even working gets them out of breath. When it's at its severe form, patients can be short of breath just at rest without doing much activity or when they go to sleep at night. Oftentimes our patients will complain of being fatigued. They just get tired easily. They don't get the sensation of shortness of breath, but they are just feeling run down at the end of the day.
Doctor, when you get to this point, you've lived a life that's gotten you to this point for some reason. What are some of those risk factors, and what are some of the things people can do to keep their heart healthy?
Sure. The number one cause of heart failure in this country is coronary artery disease. So that is where you have blockages in the heart. Usually our patients have had a heart attack at one point. Our treatments for heart attack are becoming quite good, so people are surviving their heart attack, but oftentimes will later develop heart failure. The risk factors for heart attacks and heart disease are smoking, being overweight, having poor cholesterol, and high blood pressure. Oftentimes, some of these things like high blood pressure, people don't know about it, and they need to see their doctor. Patients who have these risk factors are at risk for having a heart attack, and that can lead to subsequent heart failure.
You brought in this device that is implanted,
Sure.
and it's it would appear to be quite a complicated device.
Sure. So our treatments for heart failure are typically medications. So patients can oftentimes do quite well on medications, lead a normal life. But for some patients, they do not respond to medications. So for them, the only options are typically transplantation, a heart transplant, or an LVAD, or a ventricular assist device. This here shows what a ventricular assist device does. This is a surgically implanted pump which attaches to the heart and then sends blood, which basically bypasses the heart, sends blood to the main vessel in the body called the aorta. This pump is internal, but it is supplied by battery.
Go on this?
Yes.
Yeah.
So this a cord will come out of the patient's body, usually in the abdomen, and that will attach to batteries that they wear. Oftentimes, when patients hear about this, they say, "How can I live with batteries, with being connected to a controller?" And it does provide. There are some lifestyle changes that need to be made, but patients will say, "I'm not out of breath anymore. I can live." The problem with heart transplantation is that there's not enough hearts, there's not enough donors to go around. So patients in the old days, in the 10 years ago, used to die on the transplant list. Nowadays, with these LVADs, patients can receive an LVAD and feel well and can be at home and wait for their transplant. Some patients are too old to be transplanted if they're in their 70s or 80s, and they can receive this as an alternative therapy.
Well,
medical advances make it better.
Right.
Yes.
Certainly best to avoid the controllable risk factors
Yes.
if you can.
So thank you, Doctor, so much for coming.
Oh, thank you.
Appreciate it.
Pleasure to be here.